Hello, One Hopers. It's a great privilege to share a quick update with you today on where we are at the moment in the Western Cape regarding coronavirus from a medical point of view. My name is Veronica. I'm an anesthesiologist and I work in a small government hospital in Paarl. At the moment, unfortunately, corona is still very, very real, and this pandemic is far from over. Its effects being even more far-reaching than we initially thought. Globally, 16 million people have been infected, and in South Africa we have the 5th highest number of infections, currently sitting at a total of about 440,000 people. 60% of those have already recovered. In the Western Cape, we have about 90,000 total cases, active cases at the moment being 11 to 12,000. And about 2 to 3 weeks ago, when we were in our peak, we were looking at about 16 to 19,000 cases, active cases. So that is definitely encouraging as it's decreased. We have about 1,500 hospital admissions and currently about 270 in ICU. In our peak 2 to 3 weeks ago, we had about 350 patients in ICU, and that was at our max capacity, so that is also decreased, which is very encouraging. ICU admissions also remain the same regardless of how many people are being tested, so that decrease is also very encouraging. So what does this actually mean? This means that most likely in the Western Cape we have passed our peak and that we are now in a very slow, long tail of decreasing phase. It's really difficult to say how long this is going to take, months for sure, but it depends on whether we get second waves, what the response is to that, and that depends on many things, how people behave and so on. It is natural to get small ups and downs even in the tail as it decreases off in time. And this is where we all also come in. I know that it is so difficult. We're all going crazy at home with social distancing, not interacting with people, such an abnormal life, wearing masks, sanitizing, washing our hands, sanitizing again, did I sanitize? But I want to just please ask everyone, don't give up, don't let your guard down just yet. It may not even be about you. You may be a low-risk individual, but the thing is, we don't always know where the high-risk people are. So you may not get infected yourself. You may even be asymptomatic, but you may pass it on to someone who has contact with someone who is elderly or has a low immune system. So the most loving and selfless and kind thing that we can do, and because we are in the business of loving other people, is we can protect others as much as we can as we protect ourselves and our family. So please don't give up. Keep sanitizing, wearing your masks, stay at home as much as possible, social distance, keep 1.5 meters away from people, and one day this will be over. Look after yourselves. Get enough sleep, drink vitamin C, zinc, get a bit of sun every day, and yeah, be blessed, stay safe, lots of love.